Bismillahirrahmanirrahim. So first of all, I welcome you all to this video tutorial in which I will discuss the lung cancer. But before that, I will slightly highlight that what is actually the root cause of the cancer and why the cancer develops. So first of all, let me take the bullet point. So actually, as we all know that the DNA is the genetic hereditary material that is present in our cell, and during the central dogma of life, the DNA is transcribed to the mRNA, and that mRNA is then translated to the specific proteins. That protein will either be the structural protein or the structure of functional proteins. But when there is some defect within the nucleotide sequence of the genes, so the abnormal structural or functional protein will emerge, and that protein will then cause the further problem, and the normal cell cycle will be disturbed. So, what is cancer? Actually, cancer is the abnormal and uncontrolled and purposeless proliferation of the cell is called the cancer. Actually, as we all aware about the cell cycle, that there are different phases of the cell cycle. If we consider, so the first phase was the GNR phase, that is the nascent phase of the cell cycle. Then in the G1 phase, in which some essential material is accumulated that will help in the cell division. And the other step was the S phase in which the DNA is synthesized. And then the last, and the other one was the G2 phase, in which some additional steps and modification is done regarding the new DNA. And the last one is the M phase, that is further comprises of the prophase, metaphase, and the anaphase, and the telophase. So this is the normal cell cycle that will go through all these different steps of the cell cycle. Now, what happened during the cancer? As we all know that, as I have already discussed, and give a slight touch to the gene and how the different structure and functional proteins are prepared. So कैंसर में एक्चुअली जो है ये एक कंडीशन है जिसमें जो है हमारे बॉडी में नॉर्मली जो है जब सेल डिवीजन की ज़रूरत होती है, सपोज एक कट लग जाए, सो फिर उस कट को जो है वापस रीजनरेट करने के लिए हमें सेल डिवीजन की ज़रूरत होती है। इसी तरह जो है हम अगर स्मॉल चाइल्ड्स होते हैं पहले, फिर उसके बाद हम जो है एडोलेसेंट बन जाते हैं, फिर इसके बाद एडल्ट बन जाते हैं। सो फॉर द ग्रोथ आल्सो देयर इज़ द नीड ऑफ द सेल डिवीजन, and that cell division is regulated by the different types of the gene that is present in the cell. So one of the cell is called the proto-onco gene, that is responsible for the proliferation of the cell, and the other genes that is called the tumor suppressor gene, that जब cell division की ज़रूरत ख़त्म हो जाए, मीन एक स्पेसिफिक टाइप लिमिट के बाद जो है जब सेल डिवीजन हो जाए और इसकी नीड जो है वो फुलफिल हो जाए, सो द ट्यूमर सप्रेसर जीन जो कि यहाँ पर है, they will stop further the cell division, and this is the cell जिसे हम जो रेफर कर सकते हैं is an accelerator, that is the proto-onco gene, and the brakes, that is the tumor suppressor gene. Then there is also some another types of the gene that is called the DNA repair gene. जब जो है DNA में नॉर्मल जो जब कोई म्यूटेशन हो जाए नॉर्मल प्रोसेस में, so that will repair after some times, so that is called the DNA repair genes. Normally जो है हमारे DNA में a lot of the every seconds a lot of mutation occur. And what is mutation? So mutation is the abnormality within the genetic material as mutation that may be caused by either the physical mutagen or the chemical mutagen or some other different factors. So cancers में actually both of these जो gene है, ये proto-onco gene जो कि as a accelerator काम करती है, इसमें जो है trouble होती है, फिर ये proto-onco से convert हो जाती है onco gene में. And onco, as you all know, that the study of the cancer is called the oncology. So actually the basis of the cancer is this, that there is disturbances between the proto-onco gene and the tumor suppressor gene and the DNA repair gene. So the cell will proliferate and divide abnormally. So that is called the cancers. Now when that cancer develops within the lungs, so that will be called as the lung cancer. As we have two lungs in our body, and that lungs, the right lung is further composed of the two lobes, while the left lung is composed of the right lung is composed of the three lobes, and the left lung is further composed of the two lobes, and then different normal respiratory pathway is also present there. That may be the trachea, bronchi, and other. So when the cancer develop within the cancer, so that within the lungs, so that will be called as the lung cancer. So now, what is the definition of the lung cancer? Uh, so the most common cause of the cancer death for men and women is the lung cancer. By the way, the most common type of cancer in men is the um, prostate cancer, while in the female, the most common types of the cancer is the breast cancer. So, but the lung cancer can also contribute toward the death of both genders, the male and the females. So, I, as already mentioned, that मेल और फीमेल वो दोनों जो है लंग कैंसर कैन कंट्रीब्यूट आल्सो to for the death of both male and female as well. And then what is the tobacco use account for 87% of the lung cancer. So the most common factor risk factor that is responsible for the lung cancer is the tobacco smoking, and it contributes approximately 87%, and 70% of lung cancer patient disease has spread to distant organ. सिंपल मीन ये है कि जो लंग कैंसर्स है इसमें जो है 70% जो कि पेशेंट्स है इसमें जो है even the cancer can spread from the lungs to the other area of the other area or other organs of the body as well. Suppose they can spread toward the livers and other organ as well. So we also refer this term of the cancer or these characteristics of the cancer as the metastasis as well. So now let's proceed toward the next slide. So here it is here I will mention the definition of the lung cancer. So simple mean an abnormal growth of cell which tend to proliferate in an uncontrolled way, and in some cases metastasis may occur, mean the lung cancer or the cancer within the lungs can spread to other area of the body as well. So cancer is not a single disease. So this is the most important points, by the way, that the cancer is not only a single disease, rather it is a group of more than 100 different and distinct diseases. So it is actually a combination of the a lot of diseases, so that will be called as the cancer. And if that cancer develops within the lungs, so we refer them as the lung cancer. So that was the definition. Now, if we see and visualize this normal lungs, as the right lung has three lobes, while the left lung has two lobes. So if the cancer develops an area of this, suppose this is the healthy lungs, and now if we see and compare this healthy lungs with the cancerous lungs, so the cancer can develop an area of the lobes of the lungs, and then they may spread to other area of the body as well and can cause the further problem. This is also the healthy lungs, and this is, by the way, the cancerous lung, and there is a lot of changes, distant metastasis and effusions. So this is a necrosis that happen in the lungs, parenchyma, and the cancer, if the cancer is even in the third stage or the fourth stage, so they can spread even to other area of the body and causes the a lot of troubles to the patients. Here I will mention that the one of the most common cause of the lung cancer, secondary lung cancer, is also the lungs, because जो a lot of different types of जो cancer है उसमें जब distant metastasis होती है, so फिर वहाँ से जो है वो cancer cell जो है वो आ जाती है lungs के जो different parenchyma है, क्योंकि यहाँ पर जो है a lot of, अगर हम normal जो फिजियोलॉजी है lungs की वो स्टडी करें तो इसमें different structures आती है, जैसे कि respiratory bronchioles, terminal bronchioles, etc. So the secondary cancer can also, secondary lung cancer is also one of the most common types of the lung cancer, in which the cancer spread even from the other area of the body toward the lungs. Now, what are the types of the lung cancer? So mainly there are two main types of the lung cancer. That is the small cell lung cancer that contribute to 20 to 25% of the overall lung cancer, and the other is the non-small cell lung cancer. So this contribute to 80% of the all cases of the lung cancer. As the small refer to a small, so it means कि एक small proportion जो है वो 20 to 25% ये जो है small lung cell जो है contribute करती है in the lung cancer, while the non-small mean it is a large cancer that grow very slowly, and it contributes a majority, that is 80% of the all types of the lung cancer. Now, what will the I will discuss here in detail, in a slight detail, by the way, the small cell lung cancer. So, small lung cancer is the most aggressive. So the main feature of the small lung cancer that contribute to 20 to 25% of the all lung cancer, that it is the most aggressive form of the lung cancer. Mean here there is a lot of chances of the distant metastasis, and then the second point is the it usually start in the bronchi and then eventually affect the whole lungs. And the third point is that these cancer cells are small, so therefore it is called the small cell lung cancer, and are considered to be quite aggressive. And the main feature of the small cell lung cancer that here the cell size is small and it is aggressive in nature. And they have large growth factors. Different other types of the growth factors are involved here, like you must be familiar with the different types of the growth factor, like the tumor necrotic factor alpha, the and other growth factors like the colony stimulating factors, etc. And then the small cell lung cancer contribute 20 to 25% of the all lung cancer. So from here in this slide, we can conclude that the small lung cancer here, the cell size is small and it is aggressive in nature, and it contribute 20 to 25% of the all lung cancers. So now what is the non-small cell lung cancer? So the non-small cell lung cancer can develop in any types of the epithelial lung cancers other than the small cell lung cancer. Non-small cell lung cancer usually grows and spread more slowly. The most important thing is that here in the non-small cell lung cancer, the cell size is quite large and different from the normal cells as well. And the second feature of the non-small cell lung cancer is this, that they grow and spread more slowly as compared to the small cell lung cancer. Now, there are different further subtypes of the non-small cell lung cancer. So this may be either when the squamous cell are become cancerous, so that will be called as the squamous cell cancer. Carcinoma usually arise centrally in the large bronchi, so that will be called as the squamous lung cancer. And then the adenocarcinoma, adeno mean simply the glands. So formed from the granular structure in epithelial tissue, mucus secreting gland actually, and often found in the periphery of the lungs as well. So here mostly the squamous cell is affected, that's why it is called the squamous cell carcinoma. And then here it is here the glands is affected, especially the mucus secreting glands. Here the cancer develops, that's why it is called the adenocarcinoma. And then the large cell carcinoma can occur in any part of the lungs and tend to grow and spread faster than the other two, squamous and the adenosine carcinoma. So we concluded from this that there are two types of the lung cancer. One is the small cell lung cancer, and the other one is the non-small cell lung cancer. The small cell lung cancer, if we compare both of them, so one was the small cell lung cancer, and that contribute 20 to 25%, while the other one was the small cell lung cancer that contribute 80 to 85%. And the other point was that the small cell lung cancer grow very rapidly, while the non-small cell lung cancer grow very slowly. And then the other subtypes of the non-small cell lung cancer, like the squamous, the adenocarcinoma, and the large cell carcinoma, these are the further subtypes of the non-small cell lung cancer and it contribute 80 to 85% of the all lung cancer. Now, what are the some risk factor and causes of the lung cancer? So, the smoking is the most important risk factor and causative agent of the lung cancer. Active smoker contribute 80 to 85 to 87%, while the passive smoker contribute 3 to 5%. The old age is also one of the factor, and then the presence of the airway obstruction. That is the if we here give reference toward the mm, chronic obstructive pulmonary disease, that is the COPD, that include the two major diseases like the chronic bronchitis and the emphysema. So the chronic obstructive pulmonary disease is also one of the risk factor for the cancer. Then the genetic predisposition, is I already mentioned in the start of the lecture, that there are two types of gene that involve this that control the cell cycle. There is the proto-onco gene, and the other was the tumor suppressor gene, and the other one was the DNA repair gene. So the genetic predisposition is also one of the factors. And then the most important feature here, it is the pollution and occupational exposure to some chemicals or mutagens that cause the cancers and stimulate the cell in an abnormal way, and then the cell division occur. So abnormal cell division happens, so that will be referred as the cancers. And then the industrial work, this is also the heat resistant fiber, this is also one of the factors. And then lung diseases like the chronic disease, that is the TB, tuberculosis, that is caused by the mycobacterium tuberculosis. And then the family history, so we can link this both of them, genetic and the family as well. And then the diet, this is also one of the recently the current literature shows that diet can also contribute in the lung cancer, especially the diet low in fruits and vegetables. So these were the different risk factor of the lung cancer. The first one was especially the smoking, then the occupational exposure, then some lung diseases like the TB or the chronic obstructive pulmonary disease, and then diets in which there is a diet that is low in the fruit and vegetables. मीन जो है कम वेजिटेबल्स और कम फ्रूट्स लेना, इसमें जो फाइबर्स होते हैं या अदर जो डिफरेंट अदर न्यूट्रिएंट्स होते हैं या इवन अदर एलिमेंट्स होते हैं, दे प्ले रोल्स इन द नॉर्मल सेल साइकिल्स. सो अगर एक डाइट जिसमें जो है फ्रूट्स और वेजिटेबल कम है, सो दिस इज आल्सो वन ऑफ द फैक्टर्स फॉर द लंग कैंसर. Now, what are the sign and symptom of the lung cancer? So mainly there are two types of the sign and symptom. One is the localized, and the other one is the generalized. So the localized, it will be only localized in the lungs, while the generalized, it can involve other area of the body as well. If the especially the cancer spread or the metastasis happen, so the other area of the body will also can involve in the this type of the cancer. So what are the some localized sign and symptom? So the first one of them is the as the cancer is there in the lungs. Suppose this is the lungs, and as the cancer is developed there in the lungs, so here the main feature and the main symptom will be mainly in the lung parenchyma. So the first one is the cough and the chronic fatigue, and then the breathing problem, the dyspnea, etc. Then the blood and phlegm, that is also called the hemoptysis, and then the lung infections are the even hemoptysis, that is coughing of bloods, and then the hiccups or the chest pain and chest tiredness. So these are all the localized symptoms. Simply mean that there will be coughing of bloods. Productive simply means the chronic coughing, and then sometime in some cases there will be blood in the coughing as well, and there will be chest tightness and chest pain, and also in some rare cases there may be the breathing problem, as there are different respiratory error in present in this lungs, so there may be some breathing problem like dyspnea and even hiccups, etc. as well. Now, what are the different generalized sign and symptom of the lung cancer? जिस तरह मैंने पहले बताया कि लंग कैंसर जो है इसमें फर्दर टू टाइप्स ऑफ सिम्टम होते हैं. एक तो लोकलाइज्ड, जो कि इसमें mainly lungs involved होता है और दूसरे जो जब distant metastasis होती है lung cancer की other organs or other tissue of the body, so that will be the generalized sign and symptom. So some of them is the bony pain, then headache, the mental status changes, or neurologic finding of the patients, then the abdominal pain, also the elevated LFTs, there is a liver function test, and the hepatomegaly, that is the enlarged liver, and even the gastrointestinal disturbances like the flatulence and the gastric problem as well, jaundice, hepatomegaly, etc. So and then weight loss. But generally, so these all are the different generalized signs and symptom of the lung cancer, that even there may be a bony pain at if there is central nervous system involvement, so there may be the headaches and mental status changes. If there is an involvement of the gastrointestinal tract, so there may be some gastrointestinal disturbances, as well as it can affect the vital organ like the liver and the LFTs, alkaline phosphatase, or the AST, ALT will raise, and the patient serum levels, and there will be the weight loss. Now, how we will diagnose the lung cancer? So the first and most important feature is the chest X-ray. Then we can also perform the CT scan, the MRI, or the sputum cytology to study the sputum of the individual and observe the abnormal growth of the cells, or the to observe the cancer cell within the sputums of the individual, and then the fiber optic bronchoscopy. So we can also visually see through different cameras the these were the different tests that can be performed to diagnose lung cancer. One of the most important one is the chest X-ray, then the sputum cytology, the bronchoscopy, or even the CT scan and MRI. Now the lab test, we can also perform the blood test like the complete blood count to observe the red white cell in the platelet amount, and also some we can also perform the biopsy to determine if the tumor is cancerous or not, or even through biopsy we can determine the types of the cancer, that this is whether a non-small cell or the small cell, or even the squamous adeno or the large cell carcinoma, or even to determine the grade of the cancer, that is either fast or slow, or even in the first, second, or in the third stage. So these were the different tests that can be performed to diagnose the lung cancer. So something हम discuss करें, so we can also perform the chest X-ray, even the sputum cytology, the bronchoscopy. There is the advanced techniques, and even we can take the biopsy and some other blood tests like the CBC, etc. जिसमें हम जो है LFTs और FTs etc. को देखेंगे, या further other organs की जो function है, ये even जो blood cells है, RBC है, platelet है, वाइट ब्लड सेल्स है, इसको जो है प्रॉपरली आइडेंटिफाई करते हैं, फिर उससे जो है हम in a nutshell, in a conclusion, we identify that either this is the cancer or not, and then also the stage of the lung cancer, that at which stage the patient have currently, and what is the types of the lung cancer, either it is the squamous adeno or the large cell carcinoma. Now, the bronchoscopy. What is bronchoscopy? So actually, a bronchoscope is used to view the airway and check for the abnormality. We can also perform the endoscopy as well. It is also used in the peptic ulcer or the IBS or IBD, and the mediastinoscopy is also performed to diagnose the lung cancer, and also the WATS, that stand for the video assisted thoracoscopic surgery. We can also perform this test to visualize and study the behavior of the lungs. Now, what should be the management on the lung cancer? जिस तरह के पहले हमने डिस्कस किया कि first of all, what is the cancer, and then what is lung cancer, then some risk factor and the causes, and then some localized and generalized symptom, and then the how we will diagnose the lung cancer, then the different medical management that can be performed for the lung cancer. But mainly in every type of the cancer, these three are the primary option. The first one is the surgery, then the radiation therapy, and then the chemotherapy, in which different medications are used, maybe the radioactive materials, or even the recombinant technology product, etc., to treat the cancer. And other type of treatment is also performed like the hormonal therapy, biological therapy, or stem cell transplant, in which जब जो है normal cycle वो disturb होती है. So these are the different approaches, but the most important and most free is the, in every type of the lung cancer, we can manage the cancer through these three ways, either through the surgery, the radiation, or the chemotherapy. Now, what is the surgical treatment? So, lung cancer के लिए हम जो है different surgical procedure perform करते हैं, like the lobectomy, in which only single lobe जो है वो हम lung से remove करते हैं, जो कि जहाँ पर cancer हो. Then the bilobectomy, इसमें जो है हम two lobes जो है वो remove करते हैं, and the removenectomy, in which जिसमें जो है हम entire lungs को remove करते हैं. Then the segmentectomy, इसमें जो है small segment of the lung is removed, जहाँ पर जो है कैंसर होता है. And then the most important one is the wedge resection, जिसमें जो है एक small pie shaped area जो है एक segment का, एक small segment का, एक small portion का हम वो remove करते हैं जहाँ पर कैंसर होता है. So this is the different surgical treatment, like हम जो है suppose this is the one lungs and that is the other lungs. So हम या तो एक small lobes, one lobes remove करते हैं, that will be called as a lobectomy. The two lobes, bilobectomy. The lungs and the cancer involve both lungs or one lung, so we can even entirely remove the lungs as well. That is called the pneumonectomy, and then the segmentectomy and the wedge resection. And the radiation therapy we can use controlling the neoplasm that can't be surgically removed. So then we perform the radiation therapy. It is actually used to reduce the size of the tumor. So this is the radiation treatment, and different procedures are done for the lung cancer through the radiation therapy. Then the chemotherapy, it is used to alter the growth rate, growth, tumor growth, and to treat the patient with the distant metastasis, जहाँ पर जो lung में जो cancer होता है वो lung से even spread होता है to other parts of the body as well. So non small cell lung cancer के लिए हम जो है two drug use करते हैं, जैसे कि cis or carboplatin, that is the platinum complex, and this is the anti-cancer drugs. And then plus the some Taxane जो कि Texas bucket से हम obtain करते हैं, like the docetaxel and the paclitaxel, etc. And even the gemcitabine, that is also one of the drugs. And for the small cell lung cancer, we can use these medication like the cisplatin, and that is the platinum compound, and its anti-cancer drugs. And then the etiposide, that is obtained from the porphyrin, and then the paclitaxel, that is obtained from the Texas baccata, and then the cyclophosphamide are the some antibiotic and cancer antibiotic like the doxorubicin, daunorubicin, etc., or even the sorry, the Vencard drugs like the vincristine and the vinblastine can be also used in the treatment of the the small cell lung cancer. So this was all about the lung cancer, जिसमें जो है हमने further different चीज़ों को डिस्कस किया. अगर हम एक ओवरव्यू ले लें, फर्स्ट ऑफ ऑल हमने डिफाइन किया कि what is the root cause of the every types of the cancer, and then the definition of the lung cancer, and what was the risk factor, जिस तरह हमने smoking and asbestos exposure, or even the occupational exposures, or some COPD, or even some TB cases, etc. And then the what will be the localized and the generalized symptom of the lung cancer, and then how we will diagnose the lung cancer. So we can perform different types of the test, like the at the top the bronchoscopy, the sputum analysis, and even the CBC, or even the biopsy as well. So these different tests we have already performed in the diagnosis of the lung cancer. And then how we will manage the lung cancer. So for that, in every type of the cancer, the three main approach, that is the surgical removal, the radiation therapy, and then the treatment through the different medicinal agents. So this was all about the lung cancers. Thank you all.